Okay, let's start on medical assisting. So, what do we start? So we can classify medical assisting into two. Yes, what are they? One is administrative, and the other is what? Clinical. Medical assistant can be divided into two: administrative and what? Clinical. I think it's. Okay, the administrative medical assisting, it deals with many things. Okay, like what, for example? Administrative deals with scheduling, okay, telephone etiquette, so for about office supplies, okay, and also on the electronic health record, or which is called EHR versus EMR. Okay, so we'll start with this one, with EMR versus EHR. Okay, what do you understand by electronic health record? Anyone who knows on that?
It's from multiple organizations.
Yes, that is when we see on the difference between EMR and EHR, that's what we mean. But in general, you see medical records are divided into two. Medical records, they are divided into two. One is paper-based. The second one is electronic-based. Yes, electronic. So we have two kinds of medical records. Okay, we have paper-based and electronic. So the electronic ones are the one that we call as HR or AMR. So the difference between AMR and HR is that AMR is localized to like the same network or to the same facility, but HR has like multiple outside connection. Okay, let's say for example, if you are working in the medical office or in a hospital or in some other setting, then the electronic record that you are working will be EMR. Why? This is localized to the unit. Okay, but when it is like from outside, this has connection with insurance company, with employers, with some other many institutions outside, that's called EHR. So that's why here the definition is EHR is an electronic record of health-related information about a patient that conforms to nationally recognized interoperability standards that can be created, managed, and reviewed by authorized providers and staff from more than one healthcare organization. Okay, but EMR, an electronic health record of health information that's created, added to, managed, and reviewed by authorized providers and staff within a single. Okay, so that's the difference within the single healthcare organization and with multiple healthcare organizations. That is the difference between HR and EMR. Okay, so another thing that's very important for medical administration is what we call scheduling. Okay, it means how do you schedule patients. Okay, so usually on the electronic health record there is like what we call a template. Okay, you will have a template, and on that template you will put the name of the doctors who are working there, the patient's name, and which time they are going to be seen, and if there is a lunch break, any like short breaks and so on, all of them okay, there is a created template, and on that template you put all this data, okay, on the electronic health record. So when we deal on that, we have these different kinds of scheduling. The first one is wave booking. Wave booking. So what do you mean by wave booking? Who may understand that? Anyone? Wave booking means if you are scheduling patients for 1 hour every 20 minutes, okay, that's called wave booking. Okay, so let's say, for example, here you have Dr. Lee. Okay, he will see patients from 8:00 to what, 9 what a.m. Yes, so there are 3 patients seen. One is Martha, 2 is Lilia, 3 is Gose. Let's say just okay. I don't know there is name Gose, but okay. Okay, now, huh?
All those 3 patients are going to be seen from 8 to 9?
Yes.
Depending
Then from 9 a.m. to 10 a.m. then you will see another 3 patients.
So then it depends on who comes first. Is it like first?
Yes, that is one thing. The web booking will see first come first served. First come basis. Okay. So what she's doing is that, so if she comes early, so she will be seen the first 20 minutes, and then Lilia will be seen second 20 minutes, and in the last 20 minutes will be seen Gose.
So when you tell the patients, you tell them
You tell them to come at 8.
at 8.
Yes.
Right. So like you wouldn't tell
But
Lilia to come at like
but
8.
you can't have anyone at the same time right at the front. Someone should be ahead, yes? So the one who comes first will be seen, the next one will be seen, the other one will be
So
seen.
even if they come within like 5 minutes of each other, just whoever comes first.
Yes, who's
is seen.
coming for first will be seen, then next, then third. Whoever comes first. Okay? Okay. That is called wave booking, okay? Then the same wave booking is being modified, okay? Modified wave. It's called modified wave booking. Okay? So the principle is the same. Between 8 a.m. to what? 9 a.m. patients will be seen. Who are these patients? These 3. Martha, Lilia, Gose. Okay? But now it's not like this one. What you do will be, the first 30 minutes, Martha and Lilia will be seen. Okay? And you are left with the last 30 minutes. Gose will be seen. And you will have a flexible time, like some time like free, where you can manage something. Okay? If there is an emergency patient, okay, can come. Or if there is anyone with blood pressure check, can come. Or you have some flexible time. So this gives you a flexible. Okay? So this one, these 2, the first 2 will be seen. Will be seen what? The first 2 will be seen in the first what? 30 minutes. Then the last one in the last 30 minutes. Okay, so this is called modify. That is where the most offices use this kind of booking. Most offices use the modified wave. You can do it on this on the book if you want.
What's that? This?
Yeah, you can do it over there.
And then you sign on that.
Yeah, I mean,
That's what I thought.
yeah, you can use that. Then double booking. So double booking means when 2 patients are scheduled or appointed at the same time, is called double booking, which is not a preferable way, a good way of booking, but it's used for some, like some people, for example, they can have short procedures like blood pressure check and so on. Okay, those who do not take like a long time. So in that case, let's say to Dr. Lee, you can appoint Mr. X and Miss Y at 8 a.m. Mr. X, he has the regular checkup, but Mr. B, she came just for blood pressure check. So blood pressure check will be seen in 5 minutes, and then discuss the condition, and then we'll leave. That's why you use double booking. It's called double booking, but it's not a good kind. It's not preferred method of booking. Okay.
Now I'm talking.
Huh?
Hey, good shit. Hey, Doc.
Yes.
For real. Good job, Doc.
Yeah, it's good. Yes. Thank you.
You want to redo it now?
Huh?
So you making me want to redo it.
Yeah. So every time now we will do it. We will.
It was like the second one. Are you looking for stream schedule?
Yes.
It's the second one.
Yo, I need help.
Or something.
Is there?
It was in the. I think you passed it earlier. Keep going. Yeah.
Okay. Stream. The stream means each patient is given a predetermined appointment time based on status and needs. That means they will have a specific time to come. Let's say 9 to 9:15. Okay, then the next patient 9:15 to 9:30. So you give them a specific time. That's the only patient that's seen. There is no compromise. That is called stream. As you see, the name indicates time specific. Open booking means patients can come anytime. It's open, like a walk-in, okay, or like you show up anytime. Usually this one is for emergency, for example. Yeah, you know, you go and you walk in, yes? Yeah, you can take this one.
No, this one don't work on this.
Yeah, slow it, flash. Slow it. We have here, this one and this one.
Basically, they're giving a specific time.
Huh? And the other one is cluster or categorization. What do you understand? In that case, patients who have the same conditions or similar conditions, okay, they will be seen at the same time. Let's say diabetic patient will be seen in the morning, Thursday morning. Let's say athletes with injuries or okay, they will be seen, or post-op patients for arthroplasty, okay, will be seen Friday afternoon, like this. You know, all of them, they have what? Similar conditions. Yes, all of them, they have what? Similar cases. Okay, that kind is called cluster or categorization booking. So this is what we call scheduling. Okie dokie. Now I will open for you like one question and just you answer that one. Okay, what we do will be, we do it here. Now here you have a case here, and just what's the answer?
Just say whenever.
Huh?
Just say whenever.
Oh, yeah. Now you see scheduled what? 2 patients at the beginning of the hour, let's say at 9. And at 9:30, 1 patient is scheduled. What kind of booking is that? Modified. That's modified booking. 2 patients at the beginning of the hour. So there are still what, 3, yes? So 2 of them will be seen, okay, at the beginning of the hour, but first come, okay, and then Okay, after turning, then that's called modified web booking. Okay, sometimes it's very important to know about insurance and finance, because what is the use of knowing on insurance? Why do you need to know on insurance?
To see if the insurance covers.
Yes, whether the insurance covers. You have to deal with insurance, okay? Okay, you have to fill out a claim form. Okay, there is what we call a claim form. Okay, this claim form is what we call CMS 1500. And there is another one which is called UB04. These are claim forms. Okay, you need to know this claim form.
Yeah.
CMS 1500 is, you know it? That's for outpatient, for medical office. And this one, UB04, or sometimes called CMS 1450. It's called CMS 1450. This is used for inpatient. That means for hospitals. When patients are admitted to hospitals or long-term care, or
Well, all it is a translation of the CMS
Huh?
1500.
huh?
I said all it is a translation from the CMS.
Yes,
1500.
yes. Yeah, they are very similar. They're like the same. But one is used for outpatient, one is used for inpatient. Huh? No, they are the same. They are basically the same. But you see, patients, for example, who are admitted, you need to have a discharge note, discharge date, and so on. But the medical office, they don't have discharge. Okay, like this. But all the rest is the same. What I want to do is that I want to print out for you one copy of that, and then you take it home and then just practice on the paper.
What, the CMS?
Yes. Let's see if we can print this one.
Nicole. They want it.
Okay, let's see how we fill out this form.
Now we're going to continue on with the form. The first thing you'll notice is that there's a dark red line or dark black line about halfway down through the form. If you fold it across that, you will have the form divided in half. The top half is the patient information and the bottom half is the physician information. We're going to start with the top, the patient information. There are some tips that I'd like to give you, and I call them if-then. If you fill out a field or a box, then you must fill out another field or box. The first one is the patient name. If the patient name and address is the same as the insured's name in box 4 and 7, then you only need to write same in box 4 and box 7. You do not need to refill or recopy the insured's name and the insured's address if they are the patient. The next one is 11D. If you mark yes in 11D, then you must fill out box 9. When you mark 11D yes, it says that there is another insurance company and you must fill out that information in 9. If you don't, if you mark yes and don't fill out box 9, it is a deniable claim and there is no reimbursement. The next part of the if-then statements are in the bottom half, physician-based. And there are 3. The first one has to do with box 17, the name of the referring provider or other source. If you put a name in box 17, then you must fill out 17B, the NPI number for that provider. The next one is box 21. In box
What is NPI number? NPI number is the National Provider Identification. That means the number of each provider has, okay, an identification number. So you fill out that. So where do you fill that? You fill on 17B.
What's the name of it again?
NPI. National Provider Identification. Yes, you fill it on the. So these are called locators. So how many locators are there? 33.
Identification.
Okay, there are 33 locators. 33 locators means these are the small, okay, like 17, 16. So this is where you feel NPI is 17B. Okay?
21, there are 4 areas to write in diagnostic codes. When you write in a diagnostic code in box 21, box 24E asks for the diagnostic or diagnosis pointer. If you notice in 21, there's numbers 1, 2, 3, or 4 in front of the codes. This is what is asked for in box 24E. In this column, there only should be 1, 2, 3, or 4, not the full diagnostic code. Anything other than 1, 2, 3, or 4 in box 24E results in a deniable claim and no reimbursement. The next if-then field has to do with box 24B, place of service. If you have a place of service other than 11 or 12, you must then fill out box 32. Also, the second part of 24B is that if you have a place of service